Hi everyone. So it's such an honor and pleasure to welcome all you new medical graduates. सभी जो नए बच्चे अभी मेडिकल प्रोफेशन में आए हैं, वेलकम एंड आई एम हेयर टू टेल यू आपने ठीक किया है, आपने बहुत अच्छा किया है. Heartiest congratulations. And our goal today will be, my goal today is to tell you something which will be the game changer for your career, for whatever you will do here onwards. एक बार सोच के देखते हैं दोबारा, ठीक है? पहले सोचो, आपने मेडिकल कॉलेज ज्वाइन किया, उस दिन को याद करो. पहला दिन जब कॉलेज के अंदर आए थे, क्या सोच रहे थे, क्या चाहते थे? हमें बहुत बड़ा इंपैक्ट बनाना है, बहुत बड़ा आगे हमने एक ऐसा इंपैक्ट लाना है कि उससे दुनिया बदल जाए. हम बहुत ज्यादा लेगेसी बनाना चाहते हैं, हम जिंदगी से ज्यादा चाहते हैं जो मेडिकल ग्रेजुएट बनने आते हैं. तो उनके लिए ना मैं एक आपके सामने एक प्रोग्राम लेके आना चाहता हूं. आई वांट टू ब्रिंग फॉरवर्ड फॉर यू अ प्रोग्राम which will be the game changer in your medical career here onwards. My name is Dr. Sumer Sethi. I am a radiologist and I am the director of DAMS, and I am the person who runs the academic program in this academy called as DAMS, which we are running for last 23 years. We are India's largest as well as the oldest company offering medical education, supplemental medical education in India. And here we are today taking a step further into the first year medical education. Now what we are knowing and what we know is that when you join your first year, these subjects will become the basis of your education here onwards. Your anatomy, your physiology, your biochemistry will remain the basis of your education here onwards. But sometimes when you enter the medical college, in the euphoria of getting into the medical college, or because of the surrounding, sometimes you forget the original why. And that is why I started with the why. Your why is that you want more out of life. And to get more out of life, to get more options later on in life, we need to understand what is the curriculum of medical education and how this education will go further. In our country today, the medical education is governed by a body called as NMC. And your curriculum is called as CBME. CBME means competency based medical education curriculum. And with the introduction of this curriculum, everything has to be learned in a more clinically integrated fashion. You need to know the why behind why you are studying the basic sciences. You need to know the why behind what you are learning in your anatomy, biochemistry and physiology. And once you get to know the why and you are able to integrate it with clinical factors, you are able to build a career which is massive and which is more in tune with the global standards. As a doctor, in near future, before you start practicing, you will have an exam called as NEXT, which will test you for your abilities that you have learned in your medical college. And if you go abroad, they have licensing exams like USMLE and PLAB. So for this purpose, to build the foundation that will be required for your NEXT, for your licensing exams abroad, we have started a program at DAMS which is based on this new curriculum. This program is called as First Year Live Tuitions. This is India's first two-way interactive course, where what we do is we have a live teacher teaching you every day for 1.5 to 2 hours, and there is simultaneously two-way interaction, doubt solving happening side by side. So what we are doing here is we are trying to democratize the way in which the medical education is delivered. If you are a first year MBBS in India, anywhere, or if you have gone abroad to study your MBBS, the biggest question in your mind is, am I studying at the same level as everybody else or as the top colleges in India? We are here to democratize this. We are here to give you access to the best of the best faculty, the topmost of them, teaching you live on the app directly so that you can learn from them and ask your doubts. This is different from every other edtech platform available right now. Every other edtech platform offers you a bundle of recorded lectures. What we offer is totally different, path-breaking, a paradigm shift in the way education is delivered at the first year MBBS level. We are delivering live teaching, two-way interactive, doubt solving. Plus, we are also giving you access to the previous cycle of full lectures. Now try to imagine what will happen. The last year's full cycle of first year tuition will be available for you to see at any time. That means if suppose in your college you're doing lower limb and you want to see that topic, that is available to you at day 1 itself. And secondly, anything that will happen will be covered live also. So you will have lower limb live as per our schedule, which we will show you after this. I'll show you the schedule of the course as well. So you will have live two-way teaching as well as access to the complete set of recorded lectures of the last cycle. So you have two cycles, one live, one recorded already on the day 1 itself. So you can tailor your study according to your college schedule, as well as you will have live two-way access. It will be the game changer for your college professional exams, for your next exam, for your competitive exams. And not only that, it will have a comfortable timing, 4 to 5 classes a week, 1 to 1.5 hours to 2 hours to give you the extra edge. We are the strong proponents of live teaching in this segment. We believe that when a teacher is teaching you live, a connect is made. We believe in creating a country-wide virtual classroom. And this all will happen on the DAMS eMedicoz app, which is the India's largest live class platform for the NEET PG segment, with around 1 million downloads. And lakhs of students are attending classes, learning on different platforms, different products, and we have tailored courses for different segments. What we are offering to you is a course which is specifically tailored to first year students. These teachers will be knowing that you are first year students, and they will go at the very basic onwards. Every doubt, no doubt is silly. These teachers will will give you doubt solving even on your simplest or the silliest of the doubts. So once you learn from them, it will form the foundation that you need. This will help you go onwards. Medical education is different from school. In school, you learn many things in class 8th which are not connected to class 11th or 12th. Medical education is not like this. Whatever you will learn in anatomy will be useful even when you become a surgery postgraduate. Whatever you will learn in physiology will be useful even when you do your medicine. This is all interconnected. And once we have a strong foundation, it will give you an extra edge in every competitive exam. So that is what we bring to the table. And in this course, we will also cover the practical aspect on the app. That means there are some things that will happen in your college, in your tables, dissection tables, on the viva voce, on the practical labs. All that will also be taught to you by national level faculty members, so that once you learn from them, it will democratize the way you learn. And you will also have access to the question bank with a unique solution that most important questions where you will have doubt, you will have a video solution explaining those questions. Plus, you will also have topic-wise dedicated tests going on for you. Once again, I welcome you to this beautiful profession. And I am here to tell you, you have done the right thing. You have done the right thing by opting for this great profession. Why is this profession so great? Because as a doctor, you have both passion and purpose in one single go. That means you are pursuing what you like. You are pursuing the science of medicine. You are enjoying it. Plus, you will also be serving the humanity. It's a great combination. And I congratulate you on your choice. And I am here to be the supporting actor of your journey. Today, I am here to tell you, here onwards, you are the hero of your life. And you are building a grand movie called as a grand medical career, which will not stop at anything. You will graduate, you will post-graduate from top colleges, you will become a surgeon, a cardiac surgeon, neurosurgeon, and you will be the hero of your life. We are here to support you in this journey. We are the supporting actors in your life. We are the mentors. We will make sure that in this program, we will have live teaching, doubt solving, test, mentorship sessions, practical aid, and we'll make sure that we hone your skills to the level that once you know the basics, it will give you the killer edge in every exam subsequently till the time you appear for any kind of exam in lifelong, because these are the 3 most critical subjects. And now, before we take the things further, I invite Dr. Deepti. She is my co-director at DAMS and the academic head of the DAMS eMedicoz app. I'm sure she has some things to say to you to welcome you to this grand career. Dr. Deepti.
So hi everyone, I am so happy to be here with all you budding doctors, and you You have already entered the journey that you were so much looking forward to, and that is your MBBS curriculum. And I'm sure जब हम enter करते हैं तो हम सब ने अपने लिए बहुत बड़ा ड्रीम देखा है. वो एक ड्रीम जिसमें कोई कुछ बनना चाहता है और कोई कुछ बनना चाहता है, but every dream has to begin with a stepping stone, and that stepping stone is your first year of MBBS. Now, I am a surgeon. I'm an obstetrician and gynecologist, and, being a surgeon, I am actually very closely related to the first year subjects, because अगर anatomy नहीं आती तो हम operate नहीं कर सकते. So you have to understand कि anatomy आपको first year में पढ़ाई जा रही है और शायद surgical skills final year में पढ़ाई जाएंगे, but there has to be someone to bridge the gap, right? Someone to put it across to you कि ये जो आप पढ़ रहे हो उसका पैटर्न कैसे बदला जा रहा है, how you will learn it in an applied format, which is what is your CBME curriculum, how to integrate things, how to convert your rote learning into actually clinical work, the real thing that we as doctors want to do. And it is extremely exciting कि अगर हम इस तरीके से पढ़ें कि जो हमें ना केवल एग्जाम्स में हेल्प करे, which is primarily yes what we are also aiming for, but also makes us good doctors. Yes, someone who feels कि जो हमने पढ़ा है यार वो हम सच में उसको यूज कर पा रहे हैं, and that's where the thrill comes up, right? So चाहे anatomy हो, and you can't really do surgical branches without it, physiology हो, you can't really do medicine, pediatrics without it, biochem है. So again, so much of application in adults as well as in the pediatric, age group. So we have to understand that we are here to bring a bridging gap, a bridge between these two gaps to fill you with a journey that is not only going to teach you the content, but, help you feel that you're really doing doing what really you wanted to do. So, जैसे कि मैंने बोला, the teaching is going to be integrated. The teachers are going to ensure that they give you the basics, but at the same time raise your bar, raise your standards, raise your clinical acumen as well, है ना? So इन सब चीजों को अगर हम मिला दें तो इसके बाद और क्या चाहिए? So apart from having a good content, what you need is a curriculum, right? बहुत बार फर्स्ट ईयर स्टूडेंट्स हम अपने सीनियर्स को देखते हैं और ऐसा लगता है कि एग्जाम से 10 दिन पहले पढ़ लेंगे, है ना? सो प्लीज अंडरस्टैंड कि वो जो स्ट्रेस लेवल है, अगर वो हमारी जर्नी को जो शायद हम एंजॉयबल बना सकते थे बहुत स्ट्रेसफुल बना देता है, राइट? द फियर ऑफ द एग्जाम. सो वी हैव टू अंडरस्टैंड कि हमने ऐसा नहीं करना है कि रोज 10-10 घंटे पढ़ना है, 6 घंटे पढ़ना है, 4 घंटे पढ़ना है. नहीं, it has to be done in a consistent way. It has to be done over shorter periods of time, and it has to be done in an applied format. And this is why we at DAMS are very strongly known for the curriculum we run, है ना? So जब आप रोज 1.5 घंटा हमारे टीचर्स के साथ बैठोगे, लाइव पढ़ोगे, वही चीज फिर किताब में भी देखोगे, वही चीज फिर क्लिनिक्स या अपने डिसेक्शन हॉल्स में भी देखोगे, that's what is going to make you feel more connected to what you are doing and why you are doing, right? So I'm sure that the journey is going to bring not only excellence in your content, but also excellence in your practical skills, and definitely a journey which is going to be more smoother. That's what mentors are here for, right? So the teachers are going to, cover all aspects of whatever skills you require, be it your practical skills, be it how to answer in a viva, be it how to answer in a theory exam, or be it how to approach a clinical MCQ from the anatomy standpoint of view or from the physiology standpoint of view. And मुझे तो इतना मन करता है कि काश मेरे पास वो टाइम होता कि मैं बैठ के दोबारा से anatomy की क्लासेस को अटेंड कर पाऊं और अपने सर्जिकल क्लिनिकल एस्पेक्ट्स को फिर से anatomy को इतनी डीपली जोड़ पाऊं, बिकॉज इट जो आप डिसेक्शन हॉल में देखने वाले हो, बिलीव मी, ओटी में भी जब वैसा ही सब कुछ दिखता है तो वो एक अलग ही लेवल का आपको एड्रेनलिन रश दे जाता है. सो इट्स गुड टू स्टार्ट सीइंग कि आपका कनेक्ट कहाँ है, उन चीजों को देखना, उन चीजों को समझना और फिर उनको अप्लाई भी कर पाना is what we are here for, right? So we are going to ensure we deliver you the content, which is definitely the most important thing. Give you the curriculum. That is the second important thing. Third, give you the confidence that you can beat the exam with the all-round support of the faculty throughout the year. right? They're going to ensure कि आप कभी भी अकेले ना हो, चाहे आपका छोटा सा टेबल वाइवा हो या एक बड़ा वाला सेमेस्टर एग्जाम, right? So you're going to have it all. The teachers are here to support you. We are here to keep guiding you, and we will definitely have some wonderful clinical integrated sessions. So let the fun begin. And now, with that note, I'm going to call upon Dr. Sandeep Madan. He's the famous, in fact, I should say the most famous anatomy teacher, and he's very well known for his student connect. He's going to ensure that you start from basics, but you go to the level of the surgeons, right? So we welcome all of you, and let's start on this journey. And here I call upon Dr. Sandeep Madan.
Thank you so much, ma'am. Hello everyone, I am Dr. Sandeep Madan. I am anatomy faculty. First of all, heartiest congratulations dear students. आप लोगों ने अपने ड्रीम को पाया है जिसके लिए आपने बहुत एफर्ट करे थे, राइट? अब आपने यहाँ तक पहुँच गए. अब दिस इज द फर्स्ट स्टेप, राइट? क्योंकि ये हमारा फाइनल डेस्टिनेशन नहीं है. दिस इज नॉट आवर फाइनल डेस्टिनेशन. सो हमारा ड्रीम है, हमें अभी हमें सुपर स्पेशलाइजेशन तक जाना है, न्यूरोसर्जन बनना है, कार्डियोलॉजिस्ट बनना है. सो दिस इज ओनली द बिगिनिंग, राइट? एंड एज Sumesh sir and Deepti ma'am have already told that we have to integrate our basic knowledge of anatomy into the clinical subjects, and this is how we are going to do. And let me also tell you कि जब हम कहते हैं that we are mentors, we are guide, let me tell this point that some of the students, when they join, they are kind of like they are the first doctors from their family. है ना? They feel कि like there should be someone who can guide us, because there are certain students who will be coming from the families like who are second generation, third generation, or the fourth generation doctors. But then there will be certain students that they will be feeling that there is no one in our like family or in the seniors like who can guide us. So don't worry students, we are here for you. Okay, so we will not only teach, we will guide you, we will give the mentorship. Okay, so we are here for you. And let me just tell that when we will be solving this DQB, in this DQB, you will see that we have all the things in like subject-wise manner. When you go to subject and choose any topic here, and then you can solve the question. Each question will be supported by the video solution. So for each question, you will get the right answer. You will written explanation is there, and also video solution. So as and when you are having the doubt, you can just check the video solution, right? So dear friends, along with that, in the first year tuition, in the very initial period, we are giving you the schedule. Okay, starting with today, like it 23rd, we are going to start today at 6 p.m. Okay, and we have given you the schedule. This is how we are going to run, right? And we have provided you the all schedule till the end. Okay, so everything should be crystal clear that what we are going to study, when we are going to study. There should not be any confusion in any part of it, right? And here, let me tell you one thing. Keep, like some of your friends will say, some of your seniors will say that like this is anatomy, it is like mugging up. इसमें तो रट्टा ही लगाना है यार, इसमें क्या समझेंगे, right? But ऐसा नहीं है. This is not like rote learning. We will study the anatomy in a conceptual manner. Okay, we will understand and then remember. There's a difference. Okay, understanding and remembering is altogether different game than the pure ratta, where we don't have the idea about the structure and we are simply mugging it up. Okay, so this is one very important thing. हम सारे bones पढ़ेंगे, bones के साथ हम muscles भी पढ़ेंगे. But when we are studying, but we will be studying in a comprehensive manner, right? So for example, we will be looking at the biceps attachment. Okay, this is the biceps muscle, for example, and we will be looking, okay, these are the bony attachments for the muscle. Then what should be its action? The muscle is coming from here, right? And up to this part, it is crossing this joint. Yes, can you tell me the name of the joint? This is the elbow joint. The muscle is crossing from the front. So it will be helping in the bending of the joint. That is one of the term is called as flexion of the elbow joint. So we will be starting with the very basic terminology, because everything you have to start from the very initial. जब हमने school join करा था, है ना, तब भी हमने alphabet से start करा था. That was the very basic. Now you are using all alphabets, words and everything. But in this medical field, anatomy is the basic subject along with the physiology and the biochemistry. So we will all start from the basic, but we will take you guys to the clinical integration part, okay, where we will start from the very basic, but हम उसको इंटीग्रेट करके चलेंगे। क्यों इंटीग्रेट करना जरूरी है? फॉर एग्जाम्पल आप देखो, वी हैव टू लर्न क्लिनिकली इंटीग्रेटेड कंसेप्ट. व्हाट इज द मीनिंग? लाइक what you will gain from here? See, we have to make a strong foundation for the clinical skill. For example, like after you finish your like medical study and then you are sitting in a like clinic, some patient will come to you with some, you see, as a he will present with some complaints, right? Now as a doctor, it is your duty to diagnose, it is your duty to treat. Okay, for example, you have to give the injection. Now it is not that you will give it somewhere, right? For giving injection also, you should know that if you are putting the injection in a buttock, it has to be given in the upper and outer aspect. So there is a anatomy behind it. It is not some like illogical thing. तो ऐसा नहीं है कि हमने इंजेक्शन लिया कहीं एक लगा दिया, ऐसा नहीं करना है ना. हमें तो जानना पड़ेगा that why we are putting it here, because in the medial aspect we have the nerves. So while giving this injection, you don't want to injure the nerves. So this is important aspect. Are you understanding? So this is very, very, you see, clinically, that is the meaning of clinical integration. We have to plan the work, and this is where we will help you. Okay, and it is not only the hard work, we also have to do the smart work with dedication. For example, these all are doing the hard work, but this guy is also doing the hard work, but little bit in a smart way. Okay, so dear friends, जिस किसी को भी ऐसा लगेगा कि मेरे फैमिली से मैं पहला ही डॉक्टर हूं, कोई सीनियर मिले गाइड करने के लिए, वी आर हियर. ओके, आस्क योर टीचर, संदीप सर इज देयर टू हेल्प यू. गाइडेंस की जरूरत है, आप स्टक हो गए, शेड्यूल बनाना है, संदीप सर इज देयर फॉर यू. मोटिवेशन की जरूरत है, मेंटरशिप की जरूरत है, आई एम देयर फॉर यू. एनाटॉमी, डेफिनेटली आई एम देयर फॉर यू. ओके, तो डियर फ्रेंड्स, बिलीव इन योर सेल्फ. मैंने कहा कि हमारा कोर्स आज से शुरू होने वाला है, ठीक है. आज मिलेंगे डैम्स के eMedicoz ऐप पे. कहां मिलेंगे? eMedicoz ऐप पे. कितने बजे मिलेंगे? 6 PM. तो हमारे क्लासेस का टाइम क्या है? 6 to 8. ओके, सो 6 PM वी आर गोइंग टू स्टार्ट. I will guide you, I will mentor you, I will teach you. Okay, I will take you guys and I will help you to cross all the hurdles so that no one can stop you, and you will be definitely successful and you will get your dream come true, right? And remember, dear friends, believe in yourself. There is no secret ingredient, it's just you. Okay, so एक साथ तैयारी करते हैं आपके गोल के लिए. All right, dear friends, so we are definitely ready to help you guys in your journey. We will be a part of your journey. Okay, are you ready? Right, I welcome all of you, I invite all of you. Okay, we'll meet 6 PM today in the DAMS, on the DAMS eMedicoz app, in the first year tuition course. Okay, thank you so much.